Hello there. So today we're gonna go ahead and cover we're gonna cover a disease. We're gonna play a game of what disease is it first. I'm your host, Florentino Science Rios MD, and let's go ahead and begin. So a patient comes in and they say, "My back really hurts." What are you gonna do about that? So they're initially an 18-year-old woman. They presented to the ER on Monday afternoon. Chief complaint is, "My back really hurts." They have some pain in the paraspinal lumbar region. They describe it as a constant stabbing sensation. It radiates midway up her back. Pain's about an 8 out of 10. So the biggest thing here is that she has a lumbar stiffness. No history of trauma, no loss of movement, no loss of sensation. Everything else other than that pain is pretty much normal. Her past physical activity includes some running, not really that strenuous, no heavy lifting, nothing really too intense, nothing that would at least cause any sort of trauma to her. So past medical history, she's 18, nothing really complicated. She did have a UTI at age 12, but there really wasn't any infections after that. No past hospitalizations, no past surgical history, no history of allergies, and not currently on any medication. That means social history. She is adopted, so we don't really have any clear genetic indication on that. Current social history, she's a freshman at a fake university currently studying social work. She lives on the dorms in campus, never had tobacco, never had alcohol, never done drugs, and her last menopause is pretty regular. I have a date on there for when we actually did the study. Current review systems is currently positive for some lower back pain, pretty much negative for everything else. Physical exam, pretty much the same thing. The only thing that really is positive is that back pain right there. No, no real problems right now. So what do you guys think it is? So a lot of times you would think that maybe it's some trauma, some injury, something along those lines, something that will cause enough pain for someone to actually come into the clinic to be seen. Now, oftentimes you think it's something physical, or maybe she has something underlying. But what a lot of people don't really think about is that there is also a psychological aspect to it. Oftentimes you can feel things, pain, certain sensations, due to increased amount of stress, maybe something that brought back our memories. So current differential right now, it's of course sciatica, some radiculopathy, some disc herniation, possible muscle strain. Maybe she had a compression fracture. She is pretty young, but her menopause is, her menstrual cycles are pretty regular. Possible scoliosis, possible history of urinary tract infection. Maybe it's a kidney stone. She did have that UTI. So what will we do to work that out? Well, here we have an X-ray. We really don't see anything significant here. No clear indications of fractures or anything along those lines. Here we have some more imaging. I'm just going to go ahead and tell you that this is all pretty normal. There's nothing wrong here. So going back to the differential, what's more likely? Well, at this point, most likely it's probably some muscle strain. Maybe she was exercising, maybe she was running, maybe she fell or something, and it caused that muscle strain. Of course, you would expect it to kind of go away or kind of get better by itself, especially with rest. But what was our final diagnosis? Well, the final diagnosis was a lumbosacral strain, and she was initially discharged home. These are the medications that were given to her, and that's it, right? Well, no. You see, we saw the patient after that initial diagnosis was made. So, of course, she presented back, and that now she was having this new complaint. She can't move or feel the right side, and she still has that back pain. So now you're thinking, oh, does she have some sort of spinal cord injury or maybe some nerve damage somewhere? Of course, um, history of present illness, more or less the same. Now, everything in red, of course, is the new positive. So now the pain itself radiates down to her right lower extremity and her right upper extremity, which in itself is rather strange. Uh, the radiation, the pain itself is now a 6 out of 10. Of course, the initial pain is still an 8 out of 10. Now she has a loss of movement, right lower extremity, right upper extremity, along with the lumbar stiffness, the loss of sensation, all of that. Of course, she mentions this all in the context of there being a recent fall. So past medical history is the exact same. Social history. So we kind of got a little bit more information on that. She was telling us that she's the middle child of three. This is her first year away from home. Of course, it's the 1 year anniversary of her grandfather's death. So she currently mentioned she feels safe at home, no history of any drug abuse, and this is kind of important because sometimes when people are being abused at home or they really feel like they're unsafe, they can have these traumatic injuries or these accidents that can happen at home, and they'll come into the clinic. Their story really doesn't make any sense, so that kind of makes you a little suspicious of what might be going on back home. So review systems is essentially the same, except now we have the new onset, lots of sensation on the right side. She denies any tremors or history of seizures. She denies anxiety, depressed mood, or any elevated mood, kind of looking for mania right there. The thing is that despite all this, she's in no real distress. She's pretty okay with all this. She still has the paraspinous pain, of course. Muscle strength, absolute 0 out of 5. She can't really move her right upper extremity, right lower extremity. Um, but her ankle reflex are actually pretty good. They're a bit decreased, but they're still there, which is something that you would be rather unexpected in someone who is unable to move their arm or really feel anything. So, what is our new differential diagnosis? So, of course, many people would think it's something physical. She fell, maybe some trauma, but all of this is actually a pretty standard picture for one certain diagnosis. And here we have a differential of many different nervous type diseases. Of course, only one of these is the correct one. So here we have the same X-ray CT. Nothing really changes. They're all pretty normal. We did an MRI to check for MS. We looked at her cerebral spinal fluid. Everything is within normal limits. Of course, after all that, we still didn't really have an idea what was exactly going on, but we were able to rule out a lot of physiologic causes and a lot of problems regarding certain pathologies involving the nervous system. In the end, our differential led us down to one route, which was diagnosis of exclusion, which in itself was called conversion disorder. So, conversion disorder, what is that? So, that's actually a condition in which, so it's a psychological condition in which a person has experienced some sort of trauma in their life. They're not really conscious, it's more of an unconscious condition that is brought up by maybe some anniversary of a death of someone or some past trauma. And at that point, they lose the ability to function in a certain way. Maybe a person's wife has recently died and now they lose the ability to move their left hand, or maybe a person's PTSD has flared up and all of a sudden they lose the ability to speak. So that is conversion disorder. Oftentimes, you don't really want to say that they're faking it because they, honest to God, think that they themselves are unable to move that part of the body or they have that loss of function. So they're not really faking it. It's an unconscious psychological process. So how do you deal with these patients? So the biggest thing that you want to do is you want to make sure that they follow up with a psychologist or a psychiatrist, that they see the care that they talk about, that they talk through this trauma to kind of understand, get a better understanding of what's actually going through. And if you're able to follow up and kind of keep in contact with them, usually this the loss of ability that they had tends to kind of sort itself out after a while. But of course, the most important thing is you want to rule out any pathologic processes that might be causing this. And that will be my presentation on conversion disorder. Thank you.